Welcome to CMS You. I'm your host, Suzanne Gallagher. The Centers for Medicare and Medicaid Services, or CMS, is the federal healthcare agency that administers Medicare and oversees Medicaid and the Children's Health Insurance Program, as well as the health insurance exchanges. Women have unique health concerns, including certain types of cancers and high risk rates of chronic disease. Medicare covers many services to address these concerns, like a yearly wellness visit with a women's health specialist, bone mass measurements, cervical cancer screenings, mammograms to screen for breast cancer, and cardiovascular screenings. Medicare also covers other preventive services, so talk to your doctor about risk factors and to schedule your next screening. Today, we will be dedicating our program to an important and under-discussed health topic that affects women, ovarian cancer. Each year, over 22,000 women in the United States are diagnosed with ovarian cancer, and 50% of those diagnosed are aged 63 or older. Ovarian cancer is the fifth leading cause of cancer death among U.S. women. Early diagnosis is key to successful treatment, and the key to early diagnosis is recognizing the symptoms of ovarian cancer, which we will discuss in detail a little later on in our show. We will also discuss what is important to know about ovarian cancer, including the risks and some services that are available if you or someone you know experiences ovarian cancer. Our guest today is Pamela Esposito-Amery, co-founder and CEO of Tell Every Amazing Lady About Ovarian Cancer, Louisa M. McGregor Ovarian Cancer Foundation, or T.E.A.L for short. T.E.A.L is dedicated to spreading awareness about ovarian cancer, fundraising to support medical research, and supporting people impacted by ovarian cancer. Pamela, welcome to CMS and You.
Thank you for having me.
Thank you so much for joining us today. To start with, can you tell us a little bit about your organization and the work you do relating to ovarian cancer, as well as why you got involved in this very important work?
Sure. So I lost my sister to ovarian cancer, but before she had passed away, we actually started the foundation together. So the reason we got involved was she was diagnosed and was looking for services that we couldn't find in New York City. You know, the capital of the world where we grew up, we actually really had some trouble finding the things that she was looking for. So our foundation has three parts to our mission. And so we fund medical research because there's no screening test. We'll get to more of that, I'm sure, later. The second part is spreading awareness because a lot of women and men as well don't know a lot about this disease. And then she was looking for support. And support for women with ovarian cancer was difficult to find at the time. So we created something that she needed.
I'm very sorry to hear about the loss of your sister.
Thank you.
For people who may not be familiar, what is ovarian cancer? I know I had heard of it, but really didn't know all that much about it before I started doing the research to prepare for our show taping today. And because it's really not publicized in the media as much as other certain types of cancers are. So just so our viewers can be aware, if you could tell us what it is and what is it important to know about the disease and the effects it has on the body?
Sure. So like you said, no one's really talking about this. And so we, when we heard the name, when we found out that teal was the color that symbolizes ovarian cancer, like everybody knows pink symbolizes breast cancer, we came up with Tell Every Amazing Lady. So our name kind of says it all. We want to tell everybody about this because there is no screening test. That's what's so important about this disease. The doctors lack the tools to detect it, especially at an early stage. It's very hard to diagnose. And even when it is diagnosed, it's usually caught at stage 3 or 4, which the statistics of that aren't as positive as being caught at stage 1, but we still emphasize that people should listen through the body and really understand some of those risk factors.
Who is ovarian cancer most likely to impact? And are there risk factors that might make someone more likely to develop it? I know you said that there's no screening test, so is there anything we can maybe look out for ourselves that might tip us off that something might not be right?
Not having children, and of course having a family history of not only breast cancer, ovarian cancer, but breast cancer and colon cancer. So really knowing that family history can help you understand some of your risk as well.
Okay, very good. And you had just said there is a connection to breast cancer or other types of cancers or conditions. It may make you more susceptible if you have this risk running in your family.
Yeah, so we actually have a genetic counselor on our board at our foundation. Okay. I've had genetic testing done myself, and we did find that my family does have a gene that connects us to ovarian cancer. So my sister had it. My father actually has prostate cancer. There's colon cancer in the family. Wow. So a lot of these diseases do tend to be linked together, and a lot of people don't realize that. So even just knowing your family tree, having that open conversation with your family, maybe around the holidays or something, when you sit down for dinner, it's not the best topic of conversation, but when else do you talk about, you know, maybe what happened to grandma or great-grandma, and people aren't really sure of what their family history is, and that is something that we can also provide services for people to consider genetic testing.
No, that's a great time to bring it up, like you said, when everyone is together and maybe the family history and the knowledge is there before it's gone.
Absolutely.
So what are some of the signs and symptoms of ovarian cancer, and what should people be looking for just in general?
So ovarian cancer is really difficult to detect because it sounds like other diseases when you're looking at those risk factors or those symptoms. So when you go to the doctor and you're talking to them about bloating or pelvic pain, it's very easy to miss ovarian cancer because there's no perfect test for it. So using myself as an example again, and what we promote and tell women to do, there's 3 tests that they can talk to their doctor about, but it's not a perfect test and it still can miss it. Okay. But I myself get a CA125 blood test. Okay. It still can miss it, and it can come up with other abnormalities, but it still might show a red flag. Okay. Also, we can get a pelvic sonogram, pelvic abdominal sonogram, and a pelvic rectal exam as well. And those 3 tests combined might show a red flag, but we don't want the misconception to be, you know, anything about there being a screening test, because it doesn't exist. So everyone needs to just be diligent, know about this disease, and really speak to their doctor if they're concerned.
Yeah, it really sounds like you need to stay on top of monitoring your health, and if something, like you said, persists 2 weeks or longer consistently, one of the symptoms that you mentioned earlier, that would be the time to go into your doctor and kind of like raise the red flag.
Absolutely. If it's more than 2 weeks, definitely speak to a doctor about it.
Okay. So kind of, again, leading into our next question, what can women do in general to stay aware of their health and to be proactive about their health care, you know, and about possibly preventing ovarian cancer? Is there any steps that women can take to either reduce their risk of the disease or letting it go undiagnosed over a long period of time?
Sure, there's a few things. So being on birth control reduces your risk by 50% if you've been on it for more than 5 years. That was a recent study that came out. That's pretty exciting. Okay. Also, if somebody has had children, if you've done breastfeeding, and also just listening to your body, and you know, everything that we've been saying about those signs and symptoms, and making sure that you keep up with your doctor's appointments and you let your doctor know if something has changed, if something feels abnormal. You know, we know to listen to our guts, and you know, whether you're a man or a woman, you know something isn't right, and we hear that time and time again from women who've gotten this disease, that they had this persistent nagging of a symptom and maybe didn't want to talk to their doctor about it.
Okay. So say you've experienced symptoms, you've gone to your doctor, you have requested those 3 tests that you talked about, and your doctor unfortunately does give you a diagnosis of ovarian cancer. What does the treatment for it typically look like or entail?
Sure. So everybody's different, of course, and for any type of treatment for ovarian cancer, it definitely depends on what stage it was caught at. You know, common things would be a debulking surgery, which means they'd remove the ovaries and maybe any other organs it might have spread to. Chemotherapy, standard treatments, and radiation is sometimes a possibility as well. There's other things called PARP inhibitors and other types of clinical trials people can enroll on, but it's pretty standard chemotherapy types of treatment that are common. And so you know, there's a lot of statistics about ovarian cancer where the survival rate is usually about 5 years, unfortunately, especially if it's diagnosed between stage 3 and stage 4. But I've seen 20-year survivors, I've seen 30-year survivors, and it really, you know, sometimes is also part of, you know, your mental health and all the support that you have around you as well.
And you had mentioned one of the services that T.E.A.L offers is support services. So what, if you can kind of give us an example of some kinds of types of support services that T.E.A.L offers to people who not only have ovarian cancer, but also to their loved ones and their caregivers as well.
Sure, yeah. So it was important to us when we started Tell Every Amazing Lady, where we were started by a family. My family actually needed these services, and my sister, as the survivor at the time, needed the services. So that's sort of how we've molded everything into what we do. And so we do have programs that are available for the husband who's been impacted, the son or the daughter that might have been impacted, any type of caregiver. And of course, for a woman going through it or who's in remission, whether they consider themselves a survivor or not, whether they're a patient or not. And so it's, we have a community center in Brooklyn, in Park Slope. We offer a lot of free programs at the center, but if someone can't actually attend the center, they can still call in, or we can provide video conferencing as well. And so there's support services, there's wellness, there's art therapy. So it doesn't have to feel like you're, just having a consultation or something. We really feel that everyone's joining our T.E.A.L family, and all of our events have that feeling to them, where, whatever somebody might need, if it's not an event, they also can contact us and ask us, anything that they're looking for. We have many resources. We can refer them to a place to get a free wig, or a place that they might need financial assistance, whatever somebody needs going through this disease.
I know, I just think that that's so wonderful and fantastic, because oftentimes you get the diagnosis and you don't know what to do next, and just having the information available and at hand, I think, is just so crucial into kind of the next step on your journey, educating yourself and providing the support. So.
Absolutely, yeah. Whatever anybody needs, we usually say, whatever they ask, fill in the blank, and if we don't have that service, we'll refer them somewhere that they can find it.
That's wonderful. People who have been diagnosed may be concerned about the cost of ovarian cancer treatment and receiving services. Can you tell us a little bit about the services and program that Tell Every Amazing Lady offers for free?
Sure. So we have a lot of different programs depending on somebody's needs. So if somebody can't afford maybe a wig, we can help find one for them. If somebody is looking for even financial help or travel arrangements to get back and forth to chemotherapy, we actually had a family come in a couple of years ago that I still remember when a woman was diagnosed. She wound up bringing her daughter in, who was a teenager at the time, so that she could get to know our center, so that if she was maybe too sick, or she wasn't sure if she would live longer with the ovarian cancer, she wanted to make sure that her daughter had a place to come to for support that she needed. And we still have a relationship with that daughter, and she still comes in, and she now also tells other people about this disease and really engages in some of our programs and benefits from it. So it could be, they've had support groups and art therapy we've done with families, wellness, we've even done yoga classes, and these are all absolutely free. When somebody might also be too sick to get out and get the groceries, sometimes chemotherapy can really, be tough on a family. If, one person was responsible for that, we can also partner with organizations that actually drop off food deliveries and even do cleanings, like house cleanings. So, no matter what the situation is for the individual who has been diagnosed with this disease, even if we don't have the services, we can refer them as well.
Okay, and now these are services that people would be able to access through your Park Slope location. For those of our viewers that may not be in the New York City metro area, are there any national services that you could let us know about that they could access?
Sure. So all of our services do have, at least for our support groups and any of our free workshops, have call-in options and video options. Okay. So even if we have a yoga class going on in our workshop, somebody in Savannah, Georgia has logged in and done that along with us. Oh, wow. I mentioned Savannah, Georgia because we do have some big events down there that we do. We have a walk that we do in Brooklyn, in Savannah, the T.E.A.L walk. We also have upstate New York and Connecticut, where we have locations where a lot of our volunteers are based, and so they are running awareness programs in those cities, and there's absolutely events, and all of those programs come back to our center in Brooklyn, and we refer and find whatever support they're looking for. So we've been able to work with individuals to provide something easy from afar, which would be the support group, but if somebody is also looking for transportation needs or need connecting with the clinical trial of those types of situations, we've been able to help in those capacities too.
Oh, great. So you don't necessarily need to be located here in the New York City area?
No, not at all.
Great. And how can people more learn about Tell Every Amazing Lady and get involved if they wanted to with your organization?
Sure. So we're always looking for either volunteers or people to attend our events and join our community. We really have a very family-friendly community of people who've been impacted by ovarian cancer, but also all of our programs are open free to the public as well, so that people can just learn about our programs. So visit telleveryamazinglady.org. They can follow us on social media at T.E.A.L Walk. They can come by our center, which is in Park Slope on 16th Street, and just reach out to us anytime they need want to know some information.
That's fantastic. And is there anything else you'd like to share with our viewers before we go ahead and wrap up for today?
Just to really listen to their body and make sure that, our name says it all. Tell Every Amazing Lady about ovarian cancer. Whatever you learned today, or you might go on our website and learn something, please keep that message moving along, because we don't have a screening test. So the more information really saves lives. And the color teal symbolizes ovarian cancer, so maybe next time you see it, it might be a reminder to make that doctor appointment.
Great. Thank you so much.
My name is Pamela Esposito. I am sisters with Louisa McGregor. We have co-founded the Tell Every Amazing Lady About Ovarian Cancer, Louisa M. McGregor Foundation for ovarian cancer.
My hope is that we can raise enough funds and one day there'll be a cure for ovarian cancer. I'm very lucky just for my support system alone, and very lucky to still be here today.
On Friday, April 27, 2007, Louisa M. McGregor was diagnosed with stage 2C epithelial ovarian cancer. Her battle with ovarian cancer was like any other: poorly informed, presenting symptoms, and caught later than it should have been. But it also gave us the opportunity to begin building a vibrant community of women, men, families, individuals, and survivors committed to raising their voices and making ovarian cancer heard. Our organization was born in 2009 with the first Brooklyn T.E.A.L Walk. That September, we walked to celebrate the courage of ovarian cancer survivors and the strength of the families who've been touched by this disease. That day, we planted a seed that has blossomed into something truly amazing. Tell Every Amazing Lady About Ovarian Cancer, Louisa M. McGregor Ovarian Cancer Foundation has become a national movement. Each year, we walk in Prospect Park and in 7 cities around the country, including Savannah, Georgia, Whitesboro, New York, and Litchfield, Connecticut. We walk to save lives. And our work has broadened beyond the walks. For the past decade, backed by our wonderful supporters, volunteers, boards, and staff, we've worked year-round to fulfill the 3 pillars of our mission: awareness, support, and research. There is no accurate screening test for ovarian cancer, yet early detection is the single most important factor in fighting this disease. Through public service announcements, public appearances, community events, and media outreach, we promote awareness of the signs, symptoms, and risk factors of ovarian cancer. We know how important it is for those affected by ovarian cancer to share experiences and lift each other up. With workshops and support groups, T.E.A.L has built an ever-growing network, bringing together individuals and families at our T.E.A.L Community Center and online through digital campaigns and message boards. Over the last 10 years, we have raised over $3 million and supported 23 studies at the nation's top hospitals. With no accurate screening test and a lack of funding, researchers need more help than ever. This year, over 22,000 women will be diagnosed with ovarian cancer, and over 15,000 women will die from ovarian cancer. But this year, we will also educate our community about the signs, symptoms, and risk factors. We will strengthen the support network. We will fund critical new studies Step by step, we are getting closer and closer to winning the fight against this terrible disease. Louisa passed away on March 8th, 2011. She was T.E.A.L's first amazing lady, but she will not be the last. T.E.A.L is more than just a color. T.E.A.L is hope for the future. Thank you to everyone who has watched us grow from our living room, to our community center, to a worldwide family of support and empowerment. Please continue to support us as we set off on the next 10 years. With your help, 10 years of amazing is just the beginning. We can find a screening test by continuing to raise funds. We can give every woman hope by continuing to lead the way. We can end this disease by continuing to walk. You know what would be amazing? A screening test for ovarian cancer would be amazing. That's why we walk. More research for ovarian cancer would be amazing. That's why we advocate. A cure would be amazing. That's why we believe. You know what would be amazing? A world without ovarian cancer would be amazing. That's why we are T.E.A.L.
A very special thank you to Pamela Esposito-Amery from T.E.A.L, Tell Every Amazing Lady, for being on today's show. Today we learned about ovarian cancer, its symptoms, and what you can do to stay aware of your health and detect ovarian cancer early. While ovarian cancer can be overwhelming for you and your loved ones, there are services available that are covered by Medicare and Medicaid. Having a community of support can be very beneficial if you or a loved one is going through ovarian cancer. Please visit tealwalk.org for more information about all of their programs, or find them on social media under T.E.A.L Walk. As we discussed with Pamela, there is currently no screening test for ovarian cancer, and it can be very hard to identify early. The signs and symptoms are not always clear and may be difficult to recognize. It is important to pay attention to your body and to know what is normal for you. Early detection and treatment can make a major difference, so please be sure to speak with your doctor if you believe you are at risk or if you notice any changes in your body that can last for 2 weeks or longer. Your symptoms may be a result of something other than cancer, but the only way to know is to see your doctor, nurse, or other healthcare professional. Also, make sure to ask your doctor about your level of risk for ovarian cancer at your Welcome to Medicare visit or at your next annual Women's Health Wellness visit. For more information on Medicare, you can call 1-800-MEDICARE. That's 1-800-633-4227. We are available 24 hours a day, 7 days a week. Or you can check out our website at www.medicare.gov. For more information on what Medicaid services are provided in your area for women or those with ovarian cancer, please visit your state's Medicaid website or call your state's Medicaid office. You can also visit the National Medicaid website at www.medicaid.gov. Also, please be sure to check out our new Medicare What's Covered app and our new podcast, CMS Beyond the Policy. Until next time, be well. Thank you.
Thank you.
Thank you. Hi, I'm Suzanne from the Centers for Medicare and Medicaid Services. Prescription opioid pain medications like oxycodone, hydrocodone, morphine, and codeine can help treat pain after surgery or an injury, but they carry serious risks like addiction, overdose, and death. These risks increase the higher the dose you take or the longer you use these pain medications, even if you take them as prescribed. Your risks also increase if you take certain other medications like benzodiazepines, commonly used for anxiety and sleep, or get opioids from multiple doctors and pharmacies. Medicare is dedicated to helping you use prescription opioid pain medications more safely. Talk with your doctor about all your pain treatment options, including whether taking an opioid medication is right for you. You might be able to take other medications or do other things to help manage your pain with less risk. What works best is different for each patient. Your drug plan or pharmacist may do a safety review when you fill a prescription if you take potentially unsafe opioid amounts as determined by the drug plan or pharmacist, take opioids with benzodiazepines like Xanax, Valium, and Klonopin, or if you are newly using opioids, you may be limited to an initial 7-day supply or less to decrease the likelihood of addiction or long-term use. If your pharmacy can't fill your prescription as written, the pharmacist will give you a notice explaining how you or your doctor can call or write to your plan to ask for a coverage decision. If your health requires it, you can ask the plan for a fast coverage decision. You might also be able to take other medications or do other things to help manage your pain with less risk. What works best is different for each patient. Treatment decisions to start, stop, or reduce prescription opioids are individualized and should be made by you and your doctor. So if you are suffering from pain and get a prescription for opioids or any other medication, talk to your doctor about what's right for you. For more information on opioids, you can call 1-800-MEDICARE. That's 1-800-633-4227. We are available 24 hours a day and 7 days a week. Or you can check out our website at www.medicare.gov. Until next time, be well.
Hello, I'm Hira Mirza, and this is Hira's Medicare Corner. I'm here from CMS, the Centers for Medicare and Medicaid Services, to let you know what's going on in the world of Medicare. The Centers for Medicare and Medicaid Services encourages women to make their health a priority by taking steps to maintain their overall wellness. The Centers for Medicare and Medicaid Services would like to remind women that Medicare provides coverage for a variety of preventive services that can help improve health and detect disease in women, including an annual wellness visit, bone mass measurements, screenings for cancer, including breast, cervical, vaginal, colorectal, and lung cancer, as well as screenings for sexually transmitted infections, diabetes, cardiovascular health, immunizations, nutrition counseling, mental health, and substance use counseling. You can learn more about the services Medicare covers by visiting medicare.gov, calling 1-800-MEDICARE, that's 1-800-633-4227, or checking the free Medicare smartphone app called What's Covered. Medicaid also provides health coverage to millions of adults, pregnant women, and children. To find out more about the services covered by Medicaid, you can contact your state's Medicaid office or visit medicaid.gov. Until next time.